February.
All right.
It's not like a whole body.
Oh.
Oh.
Now,
Will you tell us which things we need to verbalize and what things we're actually gonna have to
Yeah.
physically, okay, thank you,
Correct.
you're great. You're great.
Assessment.
Oh yeah, he's doing it, he's doing it.
There's already something on.
Good.
Will there already be something on? Still a wood?
No,
Oh, yeah.
no, record.
Yep. Yeah, so your patient, when you walk in for the wound one, will be like this. There will be a wound with the dressing, right? You'll do your whole spiel, 2 identifiers, safety, any pain, all that good stuff. Okay? Step 1, you're gonna place an absorbent pad under the area. Put on gloves, as it said. I know I'm a little out of order, but
Does it have to be in that order?
it took us. No,
Cause I ain't touching a patient without gloves on.
Yeah.
Okay.
yeah, that's fine. Get the bed in comfortable height. Why that's on there? I don't know. Remove the old dressing. So there's likely going to be some tape. So you'll just carefully remove the tape. Just pretend this is a legit dressing and all that stuff. So sometimes holding down the skin to pull the tape off. We're going to inspect the dressing, see if there's any drainage or anything like that on there, and what type is it, and how severe it is. Then you'll essentially put the dressing in your glove. You'll glove it up, and you'll assess the actual wound. But that's how you get rid of it. And then take off your gloves, trash them. Okay. Inspect the actual wound itself. Take measurements, color, what's the exudate, is there any slough present? You can get an initial assessment of the type of injury. This one, we can't really, because we can't tell, is there any edema? Was this a pressure injury? That type of thing. But you can get some general information if you have the whole person there. Okay, so if you look back behind Callie, I'm right around 8. So assess the surrounding skin, especially since there is a bandage there. You want to see, is there any skin breakdown, anything like that, okay? And then you're going to dispose as I showed you. So you put the bandage in one glove and pull it off. So it's trapped in the glove there. You can get rid of that. Feel okay about that?
Yeah.
Now, the next part, the sterile technique set up with your supplies. So, what you'll need, and you actually have 2 different types of kits in your bags. One is like this, one is a little bit bigger, and in my opinion, the other one is better. However, as of right now, we're checking you off with these ones, because we don't have the other ones that are in your bag. We don't have them here. So, I'm going to show you how to do the whole thing. So you need the kit. It's titled Irrigation Tray with Piston Syringe. Okay. We need an ABD pad. It says it, abdominal pad on there. ABD, abdominal pad. So we need one of those. 2 packets of 4x4s. That's gauze. 1 packet of these doodads. Looks like a long Q-tip. Cotton tip swab applicator. It's what they touched your brain with during COVID testing. And then sterile gloves. Surgical gloves, sterile gloves. They are very different.
Are we gonna be responsible during the assessment to go gather the supplies?
They'll be in the room.
Okay.
They'll be in the room. Yeah. And just like the med check, which I'll loop back on that. Okay, so things in packages like this are sterile, so no touching. In reality, the patient's not gonna be on the table I'm working on. However, in some cases, you're gonna set up on the bed. It just depends on what you're doing, what the room looks like, and all that stuff. If I were doing it, I'd be doing it on a bedside table like that. Unless it's better to set up on the bed. Larger the wound, the more supplies, you may want to be closer, just depends. Okay? So, when you open, this would obviously be fully sealed. I opened it already to check on what's going down in there. Okay, you open it up. You'll see there is almost like a cloth-like material. It's not absorbent pad, but that is your sterile field. Then there is this big bottle here. Inside of it is a syringe, a big one. And then there's an alcohol pad in there as well. Okay, so the very first thing that we do, I would have done hand hygiene before I opened that, got ready, is grab onto your sterile field, and this is how you grab it. You want to grab the outer edge, ideally in a corner, but these things are packed in there like sardines. It's hard to get to the edge, okay? So you're going to try and find a corner and open it. This is now your sterile field, okay? You would lay that out. I now have a sterile field, okay? I cannot touch anywhere inside of it, but the outer 1-inch edge is considered not sterile. So if I needed to slide this over, I can. Give myself some room, okay? Now, we can't go into the boat, the plastic thing, but we need to get this stuff out. And I'm doing this correctly? No, you do not have gloves on at this point. Okay, so all I'm doing is pinching to bring that bottle out. I'm gonna grab the bottle carefully. The syringe on the inside, I'm gonna fling onto my table. We're not using it, so I don't really care what you do with this. Okay, then there's an alcohol pad. We're not using it. I don't care what you do with it. But notice I'm touching all this stuff. I cannot put this down on my sterile field. So right next to it, because if I put it down, all the contaminants on my hand and whatnot are going to be all over my sterile field. Okay? Now, in reality, I would have a trash can close to me, so I wouldn't be muddying my environment. So again, anything in individual packages like this, they're sterile. So opening them is important. So there are 2 little tabs here. You will grab onto them, pull away, and then get them onto the sterile field. So literally on the checklist or rubric, it says toss them onto the sterile field. Okay, so it says how they're open. When you open it, you don't want to open over the sterile field. Off the sterile field, you get it to the point where you can open it and you get them out of the package. I should have probably opened a smidge more. Trash. Same thing, we got our gauze. Same thing with little tabs. Pull away, open this up. Onto my sterile field, trash. On the rubric it says 2 of these, I'm not gonna waste 2. ABD, abdominal pad, this is gonna be our dressing that we're gonna put in place. Again, not over the sterile field. Then I toss. My equipment's pretty much ready. The only thing I don't have is tape. I would have tape to tape down the actual ABD pad. Next thing is our sterile water. I'm going to show you 2 techniques. Pretend this is brand new. You can open it and pour straight in. If this was priorly open for whatever reason, we have to do what's called lipping. So, because it's already been exposed to the outside environment, what you do is pour. As you pour, you twist around the edge. So you're creating essentially sterility around the lip of the actual bottle. After that, you're ready to go. Okay. My equipment's pretty much all set up. Now the next piece is my sterile gloves. So these will come, this is already half open, this package. They will come in a package similar to this, where it will be sealed and there'll be two flaps that you open up, and then this will be on the inside. So these gloves are in this paper here, and it says cuff end, size, and sometimes it will even say on the outside or the inside which glove is right, which is left. Okay? So this one does. So you'll open this up. Before I open this package, I would have hand hygiene. So what I'm gonna do,
Question, and hand hygiene is hand washing, not sanitizing, correct?
Mhm.
When you're about to go into sterile field.
Correct. Okay, so there's these lips here. You have to essentially open this up, and this is the tricky part. I wouldn't do this right next to my patient. I just don't have room. Is you kind of have to fold these down. Remember, on the inside of this paper is sterile. So just touching the edge. I use my fingers on the bottom to push it up. I get that crease to bend the other way so it doesn't fold on itself. Okay? Now, this is where a lot of the critical fail type stuff is. Doing this part and setting up your sterile field. Okay? So once you open up here, you'll see this. But essentially, you'll see the glove is kind of like this, and then the cuff is rolled on itself. Okay, so you start with your dominant hand, and you're gonna grab the cuff. So I'm not on the outside of the glove, I'm on the inside of the glove when I do this, and then I'm gonna go in. This is a small, so it may be a little extra, but it's on. Now, sterile glove. This glove cannot go below my waist. I can't touch anything that is not sterile. So the only thing that is sterile is this glove and what I have set up over here. Now on this one, sterile glove, I go under the cuff on this one and in with my non-dominant. Well, this one's been reset up. The reason I say that is because the glove is flipped. My pinky is in my thumb. In reality, the thumbs will be on the outside. So I'm gonna,
Would you be able to tell once you cuff it?
you will determine it while it's sitting there. I just
Okay.
must have not have paid
Okay.
attention enough. So in reality, this hand would be underneath. Small. In reality, it goes on smoother than this, but.
Critical fail.
Right. If that happened, you just start over. You just start over. So just pretend this glove is on.
Looks good.
So I don't have to redo this. This pinky, there we go. Okay, so once it's on, what you want to do to get out any air, because these can be a little bit tighter, is you just interlock your hands. Again, pretend it's not ghetto. You can ditch that. You would do that in a different place, so I wouldn't even worry about it. Now you're ready to go. You're sterile, hands above. A lot of people, they keep their fingers interlocked so they are not tempted to do anything. So my hair is not long. If you got longer hair, this would have been a good thing to have up and out of your face, which most people do. So what you do here, per the rubric, is take your gauze, you're going to saturate it in the water. It's fully saturated, you're going to wring it out a little bit. You're going to take one of your cotton tip applicators and you're going to pack the wound. So it's literally going to go into the wound, and you want to keep the gauze, you don't want to go on like this. I just broke sterility, just so you know, by picking this back up and touching it. So don't do that. So if I went on just like that, flat and open, then I tried to pack it in, everything that the gauze is touching is now brought into the wound. So you have to be extra careful and kind of hold it and go into the wound with a plan where you're kind of gonna go. Okay, so let's just say we're in here, we're packed in fully. Let's just say that's good to go. Now my ABD pad. Anyone used one of these before? Yeah? Blue line up or down?
Isn't it?
Yep. This goes over the wound, whatever tape you need. Or is available and good. The paper tape isn't waterproof, but some of the other stuff is ultra sticky and really can break down the skin. Then you tape the edges.
You wouldn't use a Tagaderm?
For this checkoff,
Oh, we're
No.
using tape.
correct. So notice, I didn't use this at all. If you needed to cleanse the wound more thoroughly, then that's where this would come into play. So you'd use the syringe, draw out sterile water, and irrigate whatever is necessary. It's not on the rubric. What is on the rubric is getting this thing onto the sterile field, so that's why I showed you. Yeah.
I like it.
For sterile degloving, you just want to be careful to not touch the skin, so you don't want to take a finger and go under the glove. So you pretty much grab at the base of the cuff and you'll deglove that way. But you do the same thing with the other gloves, especially if they're in soil, and then you go under with this one and off. Hand hygiene, make sure they're in a good position, call light, all that good stuff.
Looks easy.
So actually cleaning the wound, not on the rubric. Not on the
And
rubric.
having the tools necessary.
Yeah, in reality, you probably use more 4x4s for cleaning. So cleaning would essentially mean you would go from the center of the wound outward, pull outward, never pull inward. You get one linear swipe, then a gauze gets thrown away. So the bigger the wound, or the nastier the wound, the more stuff you'll need to bring. And once you're in sterile gloves, there's no going back.
Date.
Yes, that's another one. This one, I believe your other kit, we may need to look at the top. There should be a label on when we did that dressing change. If not, I just, like if I had to do them, like I did central lines and stuff, I would just get a piece of tape, write it on there, put it on, then I'd put a piece of clear tape over it, almost like laminating it.
The dressing change tray?
Yeah, is there a label in there? Sometimes they have one.